Hi, Ben. Good to see you again.
Hi, Matt. How are you doing?
I'm good. Thanks for sending these slides through. It looks like there's been a fair bit of death and destruction going on this month. So I will go to the next slide and I'll go to the next slide and let you crack on.
Yes. So the theme of this month is turnout. Everything is being turned out in the northeast, and the Swedes have a word for it called kosslap, the particular feeling of a cow when, having been in all winter, it gets turned out. So this is all good news, really, for animals, but with a bit of a sting in the tail insofar as there are different things that they've got to deal with. So lambs first, and the one of the common ones, but ones you can do not really an awful lot about, is intestinal torsion, where the lambs, bigger lambs these are really, just eat too much grass, too much carbohydrate, too much sugar fermented in the GI tract. Greedy lambs, well-growing lambs, and then they just get a twist, and then that's it. It might be hogs, it might be bigger lambs, and really I think it's a bit of an occupational hazard, but it's the first one and it's an easy diagnosis to make. The second one is, again, one you can do not much about because the problems have already happened. And as we said before, colostrum and navels, one of the most important things you can do. And this is just to remind everyone that lambs don't necessarily just die in the neonatal period from diseases they acquire in the neonatal period. They can live a bit longer and die on you later. The top right hand corner here is a necrobacillosis after naval ill, and then the lungs on the right are full of abscesses, and those lungs on the bottom is a big abscess. Navels are very important, and to differentiate these lesions from the Pasteurella lesions, which we'll discuss in a second. But now you're starting to get onto the ones you can do something about, and this is Pasteurella pneumonia. The pathogenesis of this obviously is that Pasteurella is starting to arrive in lambs' throats, probably from their dams mostly, with dubious levels of immunity, and some of those Pasteurellas against which the lambs are probably not going to be very immune will go into the lungs or into septicemic, and this is a sort of lungs that you're going to get. I think the gross appearance is pretty much enough to make the diagnosis. The question you have to ask yourself is, what is the underlying cause? Now, it might just be that changing Pasteurella environment in the upper airway, but are there any underlying factors that you might wish to consider? One of which is emerging as an increasingly important pathogen in parts where it wasn't perhaps possibly before, is ticks. And tick-borne fevers, we were just discussing, there's tick-borne fever, there's louping ill, there's tick pyemia. All these things are pretty easy to diagnose. Take a bit of spleen for tick-borne fever, and it's worth knowing and if it's present, because then you can consult your vet and do something about it. The point is, with Pasteurella pneumonia, just what are the underlying factors? And the next one, another one I've had this week, is cocci. The question is always, what comes first, nematodirus or cocci? So it's cocci first, then nematodirus. So don't treat lambs for nematodirus when it's really cocci, and the other way around.
Always look at the SCOPS nematodirus forecast, because we've seen a big difference this year in terms of what's happened down south. I think we're probably going to be about the same as normal in the north of England.
I think so.
Scotland might even be a bit earlier than their normal.
I haven't seen any yet, but I have seen lots of cocci. What the point of all this is that, lambs just like to die, be found dead. You never know what you're going to get till you look, so don't waste a dead one. Anything can present as sudden death. And then we ought to move on to the ewes presenting with sudden death. Again, same applies. You're going to get some degree of intestinal torsion because they've just lambed. There's a lot of room in their abdomen that's suddenly available. There's suddenly a big change of diet, lots more carbohydrate probably on fresh grass, and the gut bacteria ferment all that carbohydrate. All that gas twists around, and you're going to get a degree of this. Not really an awful lot you can do about it, apart from differentiate it from the other more important diseases, which we'll discuss next. This one probably falls into the same category. Some ewes will lamb. They will have a subclinical, as in a sort of lambing injury, a bad lambing that you didn't really know was a bad lambing, or maybe you did. they live long enough to get turned out, and then later on they get peritonitis, which is this picture on the left, or they get metritis, which is this picture on the right. The damage is already done. The point here is to differentiate it from other more important diseases like grass staggers. So sheep, before they lamb, they get low calcium, because the calcium is taking the the lambs are taking the calcium out of the sheep from her bones and whatnot. After they lamb, they get low magnesium. Lush spring grass sometimes doesn't contain enough sodium, and you need sodium to absorb the magnesium across the rumen wall. And then lastly, this is hot off the press. Today, I had my first case of haemonchus in adult sheep. Who knows whether it's re-emergence of haemonchuses that have survived the winter in the abomasum, or who knows if it's haemonchuses that have come out early in the from the pastures. You would have thought that it's probably the first one, re-emergence from overwintering abomasums, but haemonchus will definitely cause sudden death in ewes, and that is something that you need to be aware of. The same goes with sudden death in calves. Here are two calves which I've seen this week. Sometimes you turn out a suckler calf which has had navel ill when it's been a calf. 1 month, 2 months later, it can die of navel ill. And here is exactly this. Peritonitis and horrible, proliferating pus because of navel ill, which the calf incredibly has survived when it was little, and doesn't die until much later on. And the last one, and this is one I've had this week again, this was a calf that was turned out one day, literally found dead the next. So, nothing you can do in terms of clinical signs and whatnot, just found dead, that's all it is. And this particular calf, as you can see on this picture, bronchopneumonia, which looks like acute bacterial bronchopneumonia. So the moral of the story this week is, especially for sheep, they have a small repertoire of things they can do. The main thing they can do is drop down dead. So don't waste a dead one, a ewe, a lamb, whatever. It will tell you what's going on. Have a quick look.
That's it. I'll leave your upside down sheep on and say thank you very much. That's a whistle-stop tour of what things are dying of right now. Very good. Thank you very much again, Ben.
Super.